Hi, I'm Shane Bales for Pro Action Sports Injury Clinic. Today we're going to be going over hip mobility. I'd like to thank Dr. Spina for this series. It's really good for people that do a lot of the same movements, so hockey players and runners who often get tight hips and they lose their hip rotation. So we're going to start out with being on the floor in a 90-90 position, or sometimes they call it the question mark position. So your knee is at 90, the back knee and leg are at 90 as well. You're going to be leaning forward, and it's not just a passive stretch. You want to actually use the muscles to contract to get to where you're going. And then you're going to hold that kind of thing for 3 seconds, back, and you're turning towards and over top of your hip, using those muscles to contract and get back there. And then forward, back, forward, and back. So you do that 3 times. Then you're going to switch sides, back into the 90-90, leaning over top of the hip, back, over top, back, and then over top again. Now we're going to go into the bear squat. So your legs should be out to the side. Ideally, we'd like to have both legs out to 90 degrees and knees against the floor. Obviously, I need to work on this a bit, but we want to push down with our elbows a bit, keep the back straight, chest up, and just feel a tension in through the front part of the groin there, as well as using the muscles on the outside part of the legs to go towards the floor. After you get to there, okay, hold that for about 3 to 5 seconds. Bring this up here, and we're going to stand up, okay? A lot of times people can bring the feet all the way towards their groin and actually stand up on their own with just their feet. But for the people that can't do that, I always do 3 deep squats with the feet together. And then we start with a deep squat with our tailbone towards the floor, arms in front, lengthening out the spine. Hold that for 3 seconds. Then we're going to do hip dips, going across, bring it down, and going across, 3 each side. Try to make sure that the toes are kind of pointed and the shin is flat on the ground. The last one here is the cricket squat, all the way down and in front. And you're going to hold that there for 3 to 5 seconds. Toes facing out, heels facing towards. A nice squat. Then we're going to go back down, and you're going to do the 90-90 position again, doing it back and forth, and then switching to the other side as well, back and forth. Okay, just to go over that, 90-90, then opposite 90-90, bear squat, stand up, deep squat, knee touches, 3 each side, then cricket squat, then back to 90-90 both sides. Thank you very much. Good luck with your hip mobility.